Welcome class 7 in our e-learning class, and you will take out page number 27 of your civics book, that means your social and political life. And in our previous class we have already seen the question that is adequate healthcare available to all. Now today we will come to know that why it is not available or what we can do to get it available. What can be done? There is little doubt that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order and improve the health situation of our people. And this can be done looking at the following example. The Kerala experience. In 1996, the Kerala government made some major changes in the state. For 40% of the entire state budget was given to panchayats. So, a nice decision was taken now by the Kerala government, that is 40% of the entire state budget, the money collected, it was given to panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for water, food, women's development and education. So, with this fund, the village, it can prepare itself. That means proper conditions like providing the facility of clean drinking water and then adequate food and women's development and education. This could be taken forward or could be uplifted. This made it possible for a village to make sure that proper planning was done for water, food, women's development and education. This meant that water supply schemes were checked. The working of schools and Anganwadis was ensured and specific problems of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remain, and these needed to be addressed. So, the government or the state government, it has taken enough steps, but still some problems existed, like the shortage of doctors, insufficient hospital beds, then shortage of medicines. All these things still persisted. Let us look at an example of another country and its approach to issues of health, the Costa Rican approach. Costa Rica is considered to be one of the healthiest countries in South America. The main reason for this can be found in the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided not to have an army. This helped the Costa Rican government to spend the money that the army would have used on health, education and other basic needs of the people. So, think about the system that they have just cut off that part of army. Instead, that amount was spent for health and for education and for other basic needs of people. The Costa Rican government believes that the country has to be healthy for its development and pays a lot of attention to the health of its people. The Costa Rican government provides basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitation, nutrition and housing. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. So you underline this one. This sentence is very important, that health education is also considered very important and knowledge about health is an essential part of education at all levels. This must be done and this must be introduced in every sector. We all must come to know about the importance of health, and we must follow or we must practice all the things which are required to keep ourselves as well as our country quite healthy. So children, with this we have completed this chapter, and in our next class either we will try to discuss this question answers or we can move to the next chapter.